This is the ultrasound image for the uterine didelphys, or in other words you can call it as a double uterus. It's basically congenital abnormality. Here on this transverse image you can see the two horns of the uteruses along with its endometrial lining running all the way from uterine fundus till the cervix. Here you can see in the longitudinal section the single horn with a single uterine lining, and on this transverse image you can appreciate the both horns with the both separate endometrial lining which runs all the way through up to the cervical level. So this is what the double uterus will appear on the ultrasound imaging. But beside this you have to confirm it on the CT or MR imaging, particularly MRI. So MRI will help you to differentiate between whether these septums are fusing somewhere between the or at the middle of the uterus, or it has its own separate lining. So this is what the uterine didelphys will appear on the ultrasound imaging. You must be very careful to differentiate between the uterine didelphys and bicornuate uterus. This is what the uterine didelphys will appear on the ultrasound imaging. The way you have to write the report for the uterine didelphys should be in that way. So you have to mention that uterus shows double fundal horns which are continue until the lower uterine body. Also mention about the endometrial lining, that separate endometrial lining can be seen running through the fundus until the cervical canal. So these are the two main things that you should have to explain, that which way the uterus and its fundus is visible to you on the ultrasound imaging. And beside this you should have to mention about the separate endometrial lining all the way down from the endometrial canal until the cervical canal, so that it should make a clear sense that you are depicting the uterine didelphys. After confirming all that, you should also mention that the pelvic MRI is recommended, because on the basis of the pelvic MRI you will be able to see whether the septum is all the way down or it is somewhere in the center fused, or what is the status of the central septum. So that's why the MRI scan is very much important. So this is what the ultrasound report will look like, and you have to write this on the report.